stomach is the muscular bag. It is forming the most widest part of the digestive tract. And the stomach is intraperitoneal organ. It is covered by peritoneum on its anterior surface and the posterior surface. The stomach, it mainly acts as a reservoir of the food, but it also helps in absorption of the alcohol, water, some amount of salt and some medicines. The stomach lies mostly on the left hypochondrium, epigastrium and the umbilical region. The external feature of the stomach shows there are rule of two. That is, there is the two surfaces, anterior surface, posterior surface, two curvature. Lesser curvature, it is the concave border, and it is also the right border of the stomach. It gives attachment to the lesser omentum. And in this concavity, there is the anastomosis of the right and the left gastric artery. Whereas this is the greater curvature, it is convex and forms the left border of the stomach. Here also there is the anastomosis of the left gastroepiploic and the right gastroepiploic artery. And it gives attachment to the greater omentum of the stomach. At the upper part of the greater curvature, there is the attachment of the spleen and the stomach with the gastrosplenic ligament, and the attachment of the diaphragm, left tomb of diaphragm and the cardiac part of stomach with the ligament known as gastrophrenic ligament. So two ligaments are along the greater curvature of the stomach. There is a two opening. One is the esophageal opening, which is known as the cardiac end of the stomach, and another is the pyloric opening, where the stomach ends and the duodenum starts. This is kept closed only when the food bolus comes, then only the sphincter it gets open. So there is no any proper anatomical sphincter, but you can find the physiological sphincter in the cardiac end. Lower end of this esophagus opens into the cardiac orifice. It lies at the vertebral level of T11. In this cardiac orifice, there is presence of the physiological sphincter. The lower end of this esophagus opens into the cardiac orifice. It lies at the vertebral level of T11. In this cardiac orifice, there is presence of the physiological sphincter. That is, this is kept closed only when the food bolus comes, then only the sphincter it gets open. So there is no any proper anatomical sphincter, but you can find the physiological sphincter in the cardiac end. This is the pyloric sphincter. The pyloric sphincter opens into the duodenum, and after we palpate it, we can find there is a presence of anatomical sphincter. That is, the circular muscle are more in amount, and it forms the anatomical sphincter in this end. That is the pyloric end. There is presence of the two angle. One angle is known as cardiac notch or the angle of His. It is present at the junction of the opening of your esophagus, that is the cardiac end of the esophagus, and the greater curvature. So this is known as the angle of His or the cardiac notch. The next angle is known as incisura angularis. You can see this incisura angularis in the lesser curvature of the stomach. In the lesser curvature, the most deepened part is known as incisura angularis. This is the point where you can draw an imaginary line and divide the stomach surface into the upper greater cardiac part and the lower pyloric part. The importance of this cardiac notch is that when we draw an imaginary line above this cardiac notch, the part above to this notch is known as fundus, and it divides the stomach cardiac part into the fundus and the body. And here in the fundus you can find the fundic ear. Body of the stomach lies between the fundus and the pyloric antrum. This body it gets distended along the greater curvature, and in this area we can find the mucus secreting cells, this chief cells and parietal cell which secretes HCl. So maximum amount of cells are present along the body of the stomach. The pyloric part is again divided into two parts, that is the funnel shaped pyloric antrum and the narrow canal, that is this known as the pyloric canal. The pyloric antrum is separated from the pyloric canal by a sulcus intermedius, which is present along the greater curvature. It is about almost 7.5 centimeter long, and in this area, in this pyloric area, they are rich in the mucus secreting cells. That is, lots of mucus are produced in the pyloric area of the stomach. This pyloric canal is about 2.5 centimeter in length, and it is tubular in nature, and it gets terminates into the pylorus. This is the termination of the pyloric canal into the pylorus, that is the sphincter itself. During surgical procedure, we can see there is a pre-pyloric vein present in this anterior portion of the pylorus, and this is the point of identification of the pyloric canal. In the stomach, we have this outer longitudinal layer of muscle fibers, middle circular layer of muscle fibers, and the innermost layer of oblique muscle fibers. And this outer longitudinal is more prominent around the greater curvature and the lesser curvature, whereas middle circular layer is more prominent around the pyloric area, that is during the pyloric sphincter area. And these oblique layers are more prominent, are more present along this cardiac notch area, but they are present all over the stomach, and the most prominent areas are these areas. There is an area known as gastric triangle in the anterior surface of the stomach, which is bounded by the lower border of the liver on the right side. That is, here you can find the liver as the lower inferior border of the liver on the right side, and the left costal margin on the right side. In this right side, the border bounded by the lower border of the left costal margin, and below by the transverse mesocolon. So this area of the stomach is directly in the relation of the anterior abdominal wall. So there is no any vital organ present there. So in this space is used for the feeding of the patient when there is a complete obstruction of the esophagus. So here they can do the surgical insertion of the tube via this gastrotomy, and the feeding tube is kept for the feeding purpose during the cancer, that is the complete obstruction of the esophagus. If it is there, then it is surgically used. So this is an important area for the clinical use. And this is the another specimen of the stomach, where you can see this is the cardiac orifice, that is the lower end of the esophagus is opening here. This is the pyloric orifice, which opens into the duodenum. This is the lesser curvature, this is the greater curvature, and this is the anterior surface. Now to see the interior of the stomach, we have cut here through the greater curvature, and this is the interior of the stomach. This is known as the gastric rugae. These all are present on the interior of the stomach, and they are irregular folds of the mucous membrane. Along the border of the lesser curvature, the gastric rugae, they form the prominent mark known as gastric canals, so that the fluid and the alcohol, they can pass directly from the lesser curvature to the duodenum through these gastric canals, which are more prominent along the lesser curvature. This rugae, they get flattened after the food it occupies the stomach area, and you can find numerous pits known as the gastric pits along this mucosa, where there is the opening of the gastric glands, which contain HCl, gastric enzymes, and the mucus secreting cells. In this interior of the stomach, it comprises of the four layer, where you have this is the mucosa, then there is a presence of submucosa, which consists of connective tissue layer, and the muscle layer. The three layers of muscles are present, and the outermost serosa. This is also a small squamous epithelium lining cells with the connective tissue present in it.